Maroon. I'm going to show you how I do a dental and set up all the instruments ready for the dental. So today we've got a wet bench, and we're not doing it, as this is a dental is a non-sterile procedure, we're doing it outside of the surgical room. So we've got a wet bench which allows the water to flow out if need be. We've got a comfort pad which would absorb the water from the dental obviously. Then we've just got a sandbag under here to elevate the head as we want to prevent any aspiration from occurring. We've got a plate here for the patient's head to lie on, a pen and gel pack to prevent aspiration and any water getting down there. We've also got hotties which we'll use to heat the patient up because when it's under anaesthetic they can get quite cold. We place a towel over the top of the hotties to prevent any burns from the patient. Today we're using some PPE. So we've got a face mask, gloves and goggles which prevent any bacteria or debris getting on the vet or the vet's face, eyes or hands. So the instruments I have today are winged elevators which are used to go around the tooth and elevate the tooth up to which loosen them for the instructors. These ones, they actually help because these ones obviously loosen. These ones will pull the tooth out. Today we have a mouth gag which is used to let the mouth, to get a clearer vision of the mouth, as this is used really adequately in surgery to open the mouth for the dental. So today we've got a periodontal probe, which this end is used to measure the pocket depth, and they have little lines on it to measure the pocket depth for each tooth. This is also the Explorer end, which is used for kind of the same thing, but you can remove plaque or any debris on the tooth. Here we have the hand scaler, which is used to obviously remove any plaque or tartar on the tooth. For both sizes of the teeth, obviously, one side small, one side's big. And then here we have the winged elevate, the curved deciduous teeth elevator, which is used to go around, which is used to cut the periodontal ligament for the tooth to elevate it to remove the tooth as well. These are all the maintenance of all this equipment. A guy comes in to sharpen them every day. Or sometimes we sharpen them ourselves using a diamond stone, which you can go like this for all different sizes, like you can do that way or you can go from longer. It depends on what size of the instrument you're doing. And we also have a stone as well. This is used to also sharpen the instruments. All the different edges are used to for different sizes instruments as well. The way we look after these instruments is that we, after its use, we Chlorhex, scrub them, place them in Metazine for 30 minutes, then place them in, we leave them to dry in the drying cabinet, then we place them in the autoclave, which sterilises them for the next procedure, like the next procedure being done for dentistry. And now I'm going to show you the dentist, how I set up the dental machine. Also, this is the headlight which is used to shine on the mouth of the canine, which allows the vet to have a good oral examine of the teeth during the procedure. And here I'm going to go over and show you a hand scaler. Obviously, I would turn on everything before even doing that. I would turn on the power point, turn the compressor on, turn the actual machine on itself. I'll obviously remove any leads for WH&S issues because tripping hazards can happen. So I'm now going to show you how I make sure the scaler and everything's set up adequately for the procedure. I'm going to get the scaler, which you can see here as it's giving enough water out. It'll be adequate for the procedure. Here we have the Profi disposal cup, which is disposable. After every use we dispose of this one. We also have the Profi paste here, which is used to polish the teeth. We place this on a low speed to test that it's on. Yes, that's working fine. Then here we have the air and the water. So there's two nozzles on this one. So we've got the water here, as you can see that's on, and the air, and that would be fine for the dentist. So here we have the drill, which is obviously we don't use the drill pieces to just test it, but I'm just checking that it's on. So we put it onto the high speed, which I'll press down on. Yep, that is on. Now I'll turn around to the back of this, where we place distilled water in this white one here, and we make sure it's filled up every time for use. We do have this, in this dark one, we've got the CLS solution concentrate, which is diluted to a rate of this bottle, and you make sure that's filled up every time as well. With the maintenance of this machine, we do get a guy to come in every 1 to 2 months to make sure that everything's running adequately, there's nothing wrong with any of the pressure gauges or anything. The way we do clean this daily is that we F10 all the leads to make sure that there's no bacteria or blood or anything like that on them, and we leave that on there for contact time. We oil these two just here, with 3 drops in each of them. Obviously dispose of this after the procedure, and then that's how we set up for a dentist shoot here at Chicken.